Hello, everyone. I'm Christopher Kent, and with me today is Dr. Ian Shtulman, who was one of the presenters at our immunity conference. And Dr. Shtulman has been very active in pediatric chiropractic. He teaches for ICPA and, of course, is very passionate about the concept of nervous system integrity and immune function. So, Ian, welcome.
Thank you so much for having me, Dr. Kent.
Well, thank you. Could you share with our audience the essence of what you presented, kind of give them a taste of the program you presented at the conference?
Yeah, the focus of my presentation at the Immunity Conference was that our experiences in utero through the birth process and very early in childhood is fundamental to establishing a healthy and appropriate immune response. We see that if an immune system doesn't have a chance to grow properly, that'll set that person back for decades to come. And so what we basically need to do is spend a lot more time and energy educating and studying and encouraging families to focus on their nervous system health, on their gut health, on their overall well-being during the preconception, pregnancy, birth and labor, and early postpartum stage for both parents and baby. It's absolutely essential that we do that early on because that's going to set the course for the rest of their life.
Absolutely. The concept of preconception care, I think, is a very important one, and it's often overlooked. You hear people say, well, so I smoke, it's only me, I'm not hurting anyone, and perhaps I should lose a little weight, but does it really matter? Those kinds of issues. And now we know that the condition of the parents prior to conception is really key. Could you touch on that a little more?
Yeah, I mean, I know growing up in the profession, listening to On Purpose since I was much younger, I remember you and Pat talking about epigenetics and the importance of lifestyle influencing gene expression and how our lifestyle choices, including the choice of whether or not to be adjusted through regular chiropractic care, can sort of activate or deactivate certain gene predispositions that can then be passed on to future generations. And so the choices that we make early in our life, throughout puberty, into adulthood, as we get ready, all of those choices build on one another. Dr. Marcia Schaefer, who teaches for the ICPA, talks about the reproductive system and the menstrual period and the pregnancy and the birth process is a reflection of the internal health and well-being of mom. And so it becomes incredibly important that we focus on keeping people well-adjusted, that we focus on making good lifestyle choices. As I say, there are 5 things that we really need in order to be healthy. We need to eat well, move well, and think well, from James Chestnut. We need to sleep well. We have to have a well-functioning nervous system. Chiropractic is really focused on that last one, right? The well-functioning nervous system. The other 4, the eat well, move well, think well, and sleep well, that's all something that our patients have to do outside on their own. And one of the things that I do is I tell our patients, especially those who are planning on having a baby, is that your health before you get pregnant, both for, by the way, both parents, right? Sometimes we want to emphasize and put the onus on mom, and the reality is dad is just as important. And so the choices and how we live before we even get pregnant can have a dramatic impact on the viability of that pregnancy, the health of that baby, the internal environment in which that baby is formed and develops and matures, and ultimately the experience of that baby coming out into the world and how they're welcomed, either in a calm, loving, beautiful, natural way, or in a very high interventionist, stressful manner. And so we know that the lifestyle makes a big difference. And we also know that from a chiropractic perspective, that subluxation will get in the way of every aspect of our health and function, especially through the reproductive process.
And I think that's very important. You spoke of those 5 elements. And as I've often said, for that stuff to work, at least to its full potential, the nervous system has to be working
Absolutely.
properly. Otherwise, the body is going to do what the body does, which is the best it can under the circumstances. And you're going to be in training into the nervous system adaptive strategies to get around the fact that there's a subluxation and that nerve function is less than optimal. And therefore, the digestive system and the microbiome and everything else, the muscles, the exercise, all of those things are going to have to work around that by somehow adapting.
Yeah, one of the things that I tell my patients is that the key to health is adaptation.
Yes,
Your ability to perceive and adapt to an ever-changing internal and external environment is paramount, not just to your survival, but your thrival, right? Your ability to thrive.
yes.
And one of the things that we know is that a subluxation will gradually shrink the capacity of the body to adapt to an ever-changing environment. And what we need to do by keeping people well adjusted is we help expand that capacity, allowing them to not just tolerate more, but successfully adapt to it so that all the changes that are happening physically, hormonally, emotionally during pregnancy, the body is much more able to handle it and just not be affected and not alter the environment in which baby is created. So chiropractic is the foundation of all of this. One of the things that I tell our patients is that the most important thing that we can do is ensure that your body is adapting as efficiently as it possibly can, because there is no more important time in somebody's life where adaptation is essential than pregnancy, birth, and the early few years of that child's life.
Getting back to the immune dimension of all of this, as a practitioner who sees a lot of children, what has your clinical observation been regarding the relationship between subluxation correction and immunocompetence?
I mean, it's really simple. Kids who are well adjusted, not just in terms of there's an issue, a musculoskeletal concern, but kids who are well adjusted for the sole purpose of locating, analyzing, and adjusting vertebral subluxation have more robust immune systems, more specific and refined immune responses, get sick less often, are less challenged when they do get sick. Overall, much healthier. Actually, some of the pictures that you see in my office, this wasn't planned, but this, where is it? This little girl right here, Elia, she came into our office. She was, I think, like 6 or 7 months old, and she had already been diagnosed with 4 or 5 ear infections. And she was on antibiotic after antibiotic after antibiotic, and eventually got a tube recommendation before the age of 12 months. And all we did was correct subluxation and allow her immune system to work more efficiently. And ultimately, she, gosh, until she moved away, I think we saw her for about 7 years, and she never once got sick for anything that lasted beyond a day or so, right? Her body had much more of a precise, efficient immune response. And so that's just an example of what I tell parents is that our immune system naturally is like a shotgun, right? It has much more of a widespread kind of a diffuse response, where our nervous system, the part of that neuroimmune connection, is that the nervous system helps refine that immune response, helps turn it from a shotgun to a rifle, allows the body to be more precise, more efficient, and have a much more refined response, which makes all the difference in the world as to whether a child has chronic recurring ear, sinus, etc., or they have a very specific immune response that gets rid of things pretty quickly and moves on. And that's what we're looking for in chiropractic. I tell all of our patients, we don't expect that your child's never going to get sick. Part of life is experiencing and interacting with the world around you. And what we want to do is make sure that your child's immune system can develop properly so that they're able to interact with the world around them without allowing it to overwhelm them or without trapping them in this chronic defensive inflammatory state. You can't, as Bruce Lipton says, you can't be in growth and defense at the same time. And we have so many kids and so many people through pregnancy who experience everything in their life in a survival context, in that fight or flight. And your immune system just cannot work as efficiently as it needs to when you're constantly focused on survival.
So, what would your parting words to our audience be? I know you have a lot of wisdom and you express it very effectively. What's your last word?
You know, one of the things that I touched on in the immunity conference is this idea of the it's called EPIC, it's the epigenetic impact of childbirth. And the idea is that birth can either be very stressful or it can be not stressful enough. There's a sweet spot in the birth process that is ideal for wakening up the neuroimmune system, for stimulating the cerebrospinal fluid flow, for allowing that child to really thrive in those first few years and develop a strong immune response. And too often, what we've done in our culture, in how society has approached birth, is we either have way too much stress with all this unnecessary intervention and inductions and you know all this cascade of intervention, or we have these scheduled cesareans that don't offer enough stress for baby, and ultimately what you see is at either end of the spectrum, kids struggle. That when you have an optimum amount of stress, as you would probably refer to as eustress, right, instead of distress, it allows that nervous system to wake up and regulate and coordinate the developmental process much more efficiently. We know from chiropractic perspective that we can influence every aspect of the criteria that fall under that epigenetic impact of childbirth. And I think it is absolutely essential that we think of chiropractic not just in terms of what happens after the birth process, but everything that leads up to the birth process. Because that's ultimately the only way that we're really going to change things around. Because once that baby is born, once that baby comes in through a stressful environment, in a toxic internal environment from mom's body, then you end up with us trying to play catch up. What we really need to do is change this around by keeping people unsubluxated and allowing them to be in much better state preconception, through pregnancy, through birth, and start off life right for both.
Well said. So, if you want more, take a look at the availability of the programs from the Immune Symposium, Dr. Shtulman's program, and the others. You can purchase them individually or as a package. And I really think that more of this can only do you and your patients good. So with Dr. Ian Shtulman, I'm Christopher Kent. Thank you.